Thank you so much. So my son was diagnosed at the age of 9 and then relapsed when he was 11, and there was a stark difference for him in terms of sociability when he went back to school. Much easier when he was 9 for several reasons. First of all, there is one single teacher overlooking the pupils, and so bonding is created in the class and it's easier, and then children don't judge as much each other. But when he came back when he was 13, it was a disaster, because his physical appearance was really odd. Because of the treatment, he was gaining and losing weight every other month. So he looked fat or skinny. His hair was growing, falling, regrowing weirdly. So he looked like a weirdo, which wasn't easy. And it's also an age where children understand what life-threatening diseases mean, which they don't really understand when they're 9. And so you project death as a child in the classroom. And so he was definitely harassed because of that, because he looked weird, because people were afraid of death. And there is no, to my knowledge, country organizing a good program, go back to school, it or whatever. Have you ever heard of best practices in certain countries?
You mean someone teaching, helping the class also to get this child back and involved in the class?
Yeah, we in the EU4Health we had also trained a trainer for education and career support, and what we did there, for example, is to really exchange about best practice examples in the different countries, and there are really few. And then we also decided, because in some countries we have legal options for support, and this is also really important because the schools need the staff. They need really the very educated teachers. Yeah, this is what we really learned is the general support very often provided. This is not sustainable. This does not work. It really has to be people knowing about the specific late effects and the situation, for example. Yeah, but yeah, this was a big part. We had one work package on the education and career support, because this is really dramatic, and it decides over, the lifespan what the child and adolescent will do. Yeah.
Did you already have a chance to talk to politics about this topic?
Going back to school, no, not specifically yet. We're currently running a project on the topic.
Yeah, very interesting, because it might change the future of these young adults, children and teenagers. Is there anything that we should be aware of when a child becomes sick, gets sick? Is there anything that parents should know, or that teachers also should know, to secure, I would say, the future of this child? That will, in the end, you said 20% of the children, unfortunately and really sadly, will not make it. But for the rest of the people, the rest of the children, they will come back to the class. They will go back. They have a lot of stuff that they will have to build. And is it only... the follow-up care is only necessary for the children, or for all the people, all the support team that has to be created around? You can go on, the three of us, the three of you, sorry.
Go on, it's just a very short comment from my side. It's so important really for everybody. Of course, as you said, it's a family, and the whole surrounding has to get education and the information. It's really, and also the care. Yeah, it's really important. And also people have to realize that this is not what we have in our minds. It's very often what children tell us. To be sick is like 1 week and then it's over. And so sometimes in the hospital, other children tell us, no, the other way around. The children in the classroom tell, oh, we saw that boy having ice cream. So he's lying, he's not sick. Because this is what we have. There's disease, and then like maybe it's a few months, but then it's over. And this is not the case. And this is, I mean, for children we can understand, but also teachers sometimes tell us, you see now it's like 4 years ago, now everything has to be fine.
Yes.
And we really cannot do this disadvantage compensation now, but this is not the case. Yeah, because it's in the course of development, and we have to realize that support has to be ongoing.
And how long should this support last for, actually? Because we are talking about, what, the first years after cancer? Are we talking about someone who was sick when he was young and still at 40 or 50, he would need some help? Because there are steps in life. I don't know if you, I mean, each child evolves with steps, and it should be the same also for the patients or ex-patients. So how long does this last? Do you have any idea?
So in general, for follow-up care, lifelong. Because also then, you know, as you, so yeah, now I don't want to cite anything wrong now, but also, you know, you have your late effects maybe already, you know, now
Yes.
we are in our mid-30s. For instance, and then, you know, it can also aggravate. So we all know that the older we get, the more prone we are to medical issues, etc. And things can come up. So, I mean, we just, yeah, you know, new research is emerging about very, very, very late effects. Then also having secondary cancers, for instance, so lifelong and whenever accessible. So I think this is the point. It needs to be accessible, lifelong, for you know, physical, medical follow-up care, but also psychosocial follow-up care. Because here we have exactly what you know, we all have phases and different steps, moments in our lives. So talking about family planning and fertility may not be very relevant for a survivor 16 years of age, who has been treated a couple of years before. But then it might be very relevant maybe 15, 20 years later. So, and then this is where support need comes in.